Good morning. I'm Dr. David Wild, Vice President of Performance Improvement, here again for Dr. Steve Seitz, our Chief Medical Officer. We're coming to you from the Dolph Simons Jr. Family Broadcast Studio here at the University of Kansas Health System. This is Mental Health Awareness Month, and our two guests this morning have been working on the front lines with our veterans long before the pandemic began. These experts warned us back in October that veterans were our canary in the coal mine as it pertains to mental health. Those experts here today are Justin Hoover, Executive Director of The Battle Within, and Adam Majors, Frontline Therapy Networks Clinical Coordinator. We'll get an update from them in just a moment, but first, Dr. Dana Hawkinson, our Medical Director of Infection Prevention and Control, is here with our numbers. How does it look this morning?
Yeah, I mean, we're still on that plateau in the mid-20s for active infections. We have 25 active infections with 9 in the ICU and 4 on the ventilator, so a little bit smaller proportion on the ventilator, which is always good. 13 additional in that recovery period as well, so a total of 38 patients, and Hayes just has 2 in that recovery period.
So stable, just at a higher rate than we were 2 weeks ago.
Yeah. Would like it to go down. We know that overall cases are going down in the United States, but, you know, again, it really plays on our local infection dynamics and kind of what's going on there. And then tomorrow we should have some more of the demographics about our patients as far as ages, symptomatology, or being asymptomatic, and then vaccination status as well.
Well, before we jump into our discussion, I don't know that we have any media on the line this morning, but I think we have some questions, maybe?
We do. Heidi with Fox 4 wants to know, what should parents be asking their pediatrician about whether to give their child a shot? And this is in light of, you might update too.
Sure. So this is probably in relation to the news yesterday that the FDA has approved expansion of the emergency use authorization for Pfizer for children from 12 now and above. And I think that means that's the first step. There's a CDC advisory committee on immunization practices, or the ACIP committee we've talked so much about. There's a meeting of that group sometime late this week or early next week, which will be the next step. But the questions now, I think, are, well, what does that mean and which kids should be getting vaccines? And so I think the first question, Dana, should 12 or 13 or 14-year-olds be getting the vaccine?
Yeah, absolutely.
Yes.
That's the easy answer, yes.
Yes. I think if there are specific concerns you have, either as they relate to your child's health history or a specific concern around vaccines, you should discuss those concerns with your pediatrician, of course. But the contraindications will be very, very few here. Really, the only one will be reaction to a previous COVID vaccine, which no one will have had.
Correct. Yeah, you know, those simple things we think about contraindications, not being able to get the vaccine because you have a peanut allergy or a food allergy or an antibiotic or other drug allergy, you know, those are not contraindications. Those are not reasons to not get the vaccine. So, but again, talk with your pediatrician. But we know that those things are common among children. A lot of children do grow out of some of those things, but those children that do have those types of issues are still eligible to get the vaccine.
So I think that the general answer is yes, and if you have a question, as always, please do address that issue specifically with your pediatrician.
And then Heidi has one follow-up question, and that question is, when will we begin to give vaccine to those younger children?
So I think the first thing is we have Pfizer vaccine doses available, and so once the advisory committee votes to approve, we would assume they're going to approve recommendation. I have no reason to suspect they wouldn't. So once that vote takes place, we'll be able to start pretty much immediately scheduling those appointments. We're already doing some work in the background to allow for scheduling to make sure that if you're 13 years old, you can't get scheduled into, say, a Moderna clinic. So that work has begun to prepare in the background so that we make sure that the right dose is available from the right manufacturer for the right age. But I would expect the same day or the next day after an ACIP recommendation.
All right, and that's all we have for media this morning.
All right, very good. Justin, you told us last October you believed warriors would be the canary in the coal mine as it pertains to mental health related to the pandemic. What exactly did you mean by that?
Sure. So the battle within serves veterans, first responders, and now frontline medical personnel. And, 2020 was a very challenging year for all of us, but especially for these professionals. We had social unrest, protests, a little thing called COVID, financial unrest and uncertainty. So there was a whole lot that were really thrown at them. And really, my experience as a veteran 10, 15 years ago in the wars, seeing the types of traumas and the burdens that they carried is very similar to a deployment in combat. And so what we know is that those traumas over time rear themselves in your daily lives, and they start to really drag you down. And so what I meant by that canary in the coal mine is we know that the mental health troubles from all these extraordinary conditions last year are going to manifest themselves in these first responders and frontline medical personnel here to come. And so we need to start treating those mental health needs now before they really fall into that pit of despair, depression, and ultimately suicidology.
Also in October, you said that COVID-19 was helping to fade the stigma around mental health. Do you still believe that's true?
I do. I think these professions and these cultures have a long-standing culture that makes it hard to seek mental health. When these are hard jobs, and you go into that knowing that. And traditional kind of old school thinking was, well, you knew it, so go ahead and drink it down and just stuff it away, and someday you'll die and you won't have to deal with it. And commands are realizing that that's not the appropriate way to tackle mental health, that their people do need help, and they are we are really seeing that they are changing the way that they attack mental health and support their people. And I think that will continue. We've seen a big spike in people reaching out for help. And as advocates within those ranks continue to come back and really show that they can receive that mental health and it won't affect their jobs, it won't affect their livelihoods, it'll make their lives better, more people are likely to reach out for that. So I do think the stigmas are coming down. I think that there's a lot of work that needs to continue, just because there is some institutional trust, some hesitancy, much like we see with the COVID vaccines. And so there is work that needs to continue there, and that's really these commands, these administrations continuing that commitment to their people and supporting their mental health.
And have you seen a change in the demand for services since the pandemic began?
Yeah, we certainly have. We stood up Frontline Therapy Network to provide 6 to 10 free therapy sessions for veterans, first responders, and frontline medical personnel about a year ago now. And the demand has just been more than we expected. We're already in 22 states and Puerto Rico, and we get a lot of folks each week that reach out and need that help. Same thing with our 5-day program that we hold here in Kansas City. Demand has really gone sky high in that. I mean, really, we had enough applicants by the end of the end of January to fill our whole year schedule, and they just keep coming. So the good news is that people are reaching out for help, and this is our opportunity as a community to provide them that support and provide them that healing so they can resume their lives and reclaim their lives without falling into that pit of despair, depression, and ultimately suicidology.
And what about the supply of counselors? As this demand has increased, have you been able to make the right connections with resources for these people with needs in the community?
Yeah, we certainly have. Our clinical team is amazing in finding and vetting these folks, and hats off to these therapists. Obviously, mental health is a huge concern for a lot of people. A lot of folks are booked, and they really provide their time at a reduced rate to be there and support these frontline warriors that have really supported our community and kept Kansas City safe over the last year plus. And so we're very fortunate to have an amazing cadre of therapists, and If there are any interested, we could always use more because, as I said, that demand continues to grow. But yeah, we've been very fortunate thus far.
Adam, you're a veteran, and you authored the Battle Within curriculum. You help coordinate help for lots of warriors. How do you screen warriors and pair them with the right resource therapist or counselor?
A great question. And just like screening or doing an evaluation or assessment with any other psychotherapy client, we take into consideration a variety of factors when we're thinking about who we want to pair them up with or what kind of therapy or treatment we want to recommend that they seek out. And the veteran population is not a monolithic population. It's a very diverse population with a wide variety of potential underlying causes to their suffering. And I think one of the big mistakes that unseasoned clinicians might make is to assume that if they're working with a warrior or a veteran or a first responder, that the problem must be trauma and PTSD arising from some life-threatening encounter or combat. And in reality, and I've been doing this work since 2014, worked with hundreds of different veterans and first responders, it's an extreme minority of our clients who have actually been in those kinds of situations, who've been in combat. And in general, a lot of the problems tend to arise from the same kinds of things that everyone else experiences with some differences. So when we're doing our evaluations, we're looking at their character structure or personality structure. We're trying to get a sense of what makes them tick. We're trying to get a sense of what their history is and what they experienced in childhood, and even kind of the underlying assumptions they might hold about psychotherapy or self-care or healing itself. And are they able to be emotionally flexible and vulnerable, open up, share, grieve, mourn, to talk to others? And so all these things are really, really important for us when we're thinking about what kind of therapy we want to send someone to.
Mm-hmm. It sounds like this very comprehensive sort of assessment helps you really create a tailored and very individualized treatment plan, support plan as well for anyone seeking care.
Absolutely. Yeah, it's really important. I like to use the analogy that it's like if someone goes to a doctor and they say that they have a headache, that there's a lot of potential reasons someone might have a headache. And it could be something like if you have a lot of tension and stress or maybe bad posture, that perhaps stretching could alleviate the headache. Or it could be something where there's a really serious underlying medical concern that requires surgery. And the same principle is at work when it comes to psychotherapy. So a thorough assessment's vital to make sure that we get a sense of whether one treatment or another is more likely to be successful for each person.
Mm-hmm. And with this increase in demand, how do you, from your perspective, how do you feel that the providers, that mental health experts and professionals are holding up with this demand increasing?
Well, we are humans too. And I think that in general, most of the psychotherapists that I know, and I'm fortunate to work with dozens of providers in a variety of different settings, from private practice to coordinating with, the 60 plus clinicians we have in the Frontline Therapy Network. And most clinicians or most psychotherapists are no strangers to personal hardship. So most of us have been through some form of initiation in our own psychotherapeutic treatment. And that doesn't mean we don't suffer, but I think that it does help us respond to tough situations when they arise. So it's a resilient group of folks, and it's been a hard year for everybody, therapists included. Most therapists I know are busier than they've ever been, and they're going through the same kinds of challenges as their clients. So without a doubt, I see a lot of my colleagues reaching out to one another. I've done it myself, and I think that that's really important for all of us.
Why should someone who feels concerned or feels they have a need for services, why should they reach out?
Well, for all of our clients and for anybody looking or thinking about reaching out for help, I just reassure them that therapy works. The evidence shows it works. And we know that that if you're getting the right treatment, the likelihood that you're going to enjoy an improvement and see your symptoms reduce, it's going to happen. And you have to stick with therapy. You've got to stay in it. So if you've been in therapy and you felt it didn't work the first time, go back and try a different therapy. Maybe consider having a thorough evaluation done. Reach out to us and to our team, and we'd be happy to talk to you. And we'll be really honest and transparent and kind of talk through the different options with you so that you understand, how we can get you on the road to healing.
And maybe from the opposite perspective, why should therapists in the community who maybe want to help, why should they be signing up with you with this program?
I think in general, most of our therapists are satisfied with the kinds of clients that we refer to them. So the folks that we work with tend to be really exciting population and really rewarding population to work with. So we're really thoughtful and intentional when we make the pairs. So we get to know our therapists the best we can. We get to get an idea of what kinds of clients they want to work with and what kinds of presenting problems and where they feel like their skill set is. And we try to send everyone the kinds of clients that they're going to be really eager to work with. And them are really, really finding the experiences they have rewarding. I hear from clinicians that are working with clients that we referred to them a year ago and just comment about, what a pleasure it is to be a part of it.
And for those, actually for both of you, but Adam, we'll start with you. As you think about the signs or symptoms that you would want someone to know means you should seek help, whether it's related to a post-traumatic experience or whether it's depression or anxiety, what are those signs and symptoms you feel are important, right? This is the point at which you need to reach out for help.
Well, I have a personal bias here. And in general, I think that it's great to see a therapist no matter what or no matter how you're doing. But if you're suffering and feeling uncomfortable and more than a few days a week, you feel a lot of emotional discomfort, definitely reach out for help. And I don't think that there's anyone who wouldn't stand to benefit from the psychotherapeutic process. So I'm a big believer, and if you've been thinking about it and putting it off, that just make the commitment and go. But without a doubt, if you find yourself in a state of despair or noticing that there's something that might be a problem that you think just might go away and it's not, and if that's persisted for more than a month, definitely, without a doubt, reach out and don't hesitate even to reach out if it's something that's been a shorter amount of time. Maybe it's just been a week and you're really feeling vulnerable and like you could use a helping hand. That it's never a bad time to reach out to a therapist.
And Justin, your perspective, are there things or signs that say, boy, now is the time?
Yeah, I think your initial comment or question of if you're concerned, what are those signs to look for? And I think that simply, if you're concerned, then yes, you should reach out. I like the analogy in the military when a car bomb or mass casualty happens, you don't tell the medic, well, I'm going to go later, take care of those folks first. Our veterans, our first responders, our frontline medical personnel, nurses and doctors, they like to be the selfless servants, but we don't triage ourselves. And so if you feel you have a concern, reach out. There's probably something there, and we can get you to the services that you need and that you deserve, because there's a rich, rewarding life waiting for you if you just stop witnessing it and start experiencing it again. And those coping mechanisms that you build keep you from experiencing it fully. So these are the tools and the experiences you need to go to reclaim that and experience your life again.
Very true. It's hard to be your best for those that you're trying to serve or support if you're not taking care of yourself as well. So.
That's right.
All right. Great conversation so far, Jill. Let's get to some questions from the community this morning.
We have great questions today about the vaccine, but Isaac has two questions that are on topic that I think are really good. So I'm going to start with Isaac. Isaac asks, what do you say to people who fear getting help because they feel like they'll be fired from their jobs or lose something?
Yeah, that's a fantastic question and a really hard one. Again, these populations that there's kind of some deep cultural mistrust, and it's a very challenging conversation to have. I would say one of the powers of the battle within is the confidentiality of the program. We're Switzerland. We work with departments and administrations, but we don't work for them. Our warriors are our clients, and that confidentiality allows them to seek that treatment in a setting that protects their jobs. And so finding resources like that to just start. And it's probably not going to happen the first time you have the conversation, but continue to have the conversation. And eventually life will get hard enough where there's that moment of vulnerability when they raise their hand and realize they need help. And being there and empathizing with them will allow them to actually take those services when they are able and willing to do so.
Did we lose Adam?
Most folks find that their employers are much more understanding than they initially anticipate, and at the same time that it's good to talk with folks that you trust, and make a decision about whether or not talking to your employer might be appropriate. Like that maybe you'll get more support from your employers than you thought you might. And at the same time, all psychotherapists we're mandated to maintain confidentiality. We cannot reveal our clients' identities. And so I think that the psychotherapeutic frame is incredibly safe, that if you seek help and you go see a therapist, they are not going to tell anyone, and they're definitely not going to tell your employer, because we can't legally. So I do believe it's very safe to seek help, and the likelihood of someone finding out is extremely low.
I think that's an important part of the message. The concerns are very, very real and fair. It's a great question. And the sort of operational components, as you described them, are very clear. We're separate from an administration or a command, and connected but separate. And then also, regardless of that connection, we're required to maintain confidentiality. And that's an important part of the process. And that trust does need to be established and earned, and that's also fair for people to understand. Other questions, Jill?
Yeah, Isaac had a follow-up question, which he asks, are people feeling better mentally, healthy, after they get the vaccine? And I have to say, anecdotally, I did. It made me feel safer, I think.
Yeah, so Adam, I may start with you. It makes sense, I suppose, if there's relief of one source of concern or anxiety in your life, that would provide some benefit in the big picture. Are you seeing that with your clients?
Absolutely, without a doubt. And for me, I think about 99% of vaccinated now. And I've seen a pretty simple, and you might think of it as being akin to if our emotional regulation capacity is imagined as a glass that has some water in it, and all the stressors are stones or weights that we put in that cup. And eventually, if you add too many things to the cup, it's going to overflow. And I think that the risk of getting COVID for some people is a very significant one, especially if you have additional vulnerabilities. And so that getting the vaccine and getting protection from COVID is something that takes a big weight out of a lot of people's cups and gives them a lot more space to regulate their emotions and to just feel at peace in life. So I would say there's no doubt that for many of my clients, I've seen an extreme reduction in their anxiety. And in general, I think a lot of them are feeling better and just feeling more connected. They can get out and do things that they couldn't do 6 or 8 months ago or a year ago. And that's a big factor as well.
Justin, from your perspective and in your role, do you see the same sorts of benefits?
Yeah, I mean, personally, my wife was high risk for COVID, and so us being vaccinated really allowed us to resume some form of normalcy. But I think that those that I've talked to that are in that same boat, just feeling empowered that they can get back to some form of normalcy, that they don't have to worry as much. It very much seems to have relieved those stressors from them, yes.
I think that sense of normalcy and even maybe a sense of control in what has been an uncontrollable environment is not only comforting, but also does help provide a lot of sort of support in addressing the other things that may be going on in life. So it's a great question.
And Peg worries, though. She says one of the big problems is that it takes a long time to get an appointment with a therapist. How long does it take to get an appointment with the Battle Within?
It really depends on the person. Sorry about that, Justin. Yeah, it really depends on the person and their situation and their needs. So at times it's really easy, and sometimes we can connect somebody the same day. That happens often. But there's other times where we're looking for a very specific kind of therapist, and there's other factors that are involved as well, like if people who work on the night shift, sometimes it's harder to find them a therapist that can meet them at a time that they need. And when you kind of take all the different factors involved, like whether they want to meet in person, and if so, where are they located and where the therapist's located, and what kind of insurance they have, all those things add up. And sometimes it can be really difficult. And so I'll just say, another great resource for finding a therapist is Psychology Today. You can go on there and put in your zip code. You can put in your insurance. And you can put in any specific issue that you're wanting to work on in therapy, and that makes it a lot easier to find a therapist. But I just recommend to reach out to 5 or 6 people who you think might be a good option and interview them like you're interviewing them for a job, and just talk to them. And I think that kind of, just by opening up your options, it'll help you find a therapist more quickly.
From the health system's perspective, there's no doubt that at times it is hard to find the right resources in the community or really anywhere for behavioral and mental health. And our commitment to the community in that regard, whether it's at our Marillac campus, which I know we've talked about, the adolescent and pediatric behavioral health needs that are addressed there, or the Strawberry Hill campus and our adult needs. We have a commitment to provide, to the best of our ability, those services for the community. But we also know that's not something that any one of our organizations can do on our own. And so a lot of advocacy as well, I think, on all our parts, that there are needs that remain unmet. And I think we have to acknowledge that at times that wait may be longer than we want and longer than you want, and we're all doing everything we can. And so I think it's great, Adam, to hear that if there are immediate needs that you can address, you're even able to get to them same day. That's a pretty impressive statement. But also recognizing that, as you mentioned, if someone works the night shift, that's a different set of needs, and we may have to find different resources for them. But I appreciate the fact that as an organization, you're working so hard to find those immediate things where possible and when needed.
Okay, we have some vaccine questions today.
Right.
Donnie wants to know, I have a friend who had a bad reaction to the flu vaccine. She is concerned about getting the COVID-19 vaccine. Is there a reason to be concerned?
Simple answer is no. Again, very few contraindications to getting the vaccine. This includes if you have allergies to foods or other drugs or other vaccines. The only real contraindication, as Dr. Wild said, was if you have had a reaction to, say, the first vaccine dose. So again, talk with your care provider, but really there should be no concern here. Totally different vaccines, totally different makeup, totally different platform for the vaccine. She should still be able to go ahead and get it.
Yeah, really no sort of risk of cross-reactivity, if you will, if you had a problem with the flu shot. Now, a couple of things we ought to say in that. Number one, when we talk about a bad reaction to a previous COVID vaccine, we don't mean a sore arm or a fever or I felt bad for a few days. We mean anaphylaxis. That's the contraindication. So your lips swell, you have to have epinephrine injected, you have to go to the emergency room, those sorts of things. Secondly, the bad reaction question as it relates to the flu shot is probably the same. If you had a fever or didn't feel well for a day or two or had a sore arm, those aren't really bad reactions. Those are expected side effects. It sort of means that you're seeing the reaction in your body that we want to the vaccine. And so, yes, some people have more severe symptoms, a longer duration of a fever or more fatigue, or worse, chills or something to that effect. But those are not severe reactions. Those are expected side effects. And so it also bears importance in this conversation to ask that question, what was that reaction? If it was one of those things, that shouldn't be a contraindication for another flu shot or for any other vaccine, really.
Okay, a shout out to Caprell. She says, good morning. My 14-year-old is so excited to get her vaccine.
Yeah.
She realizes it is a step towards ending the pandemic. Want to give her an atta girl?
There you go.
That's good.
It is interesting. So my 13-year-old asked me last night when he would be able to get his vaccine. And his question, which I thought was appropriate, was, is it the same sort of feeling as when they give you the flu vaccine? And I said, yeah, it'd be exactly like that, buddy. And he said, well, great, I can do that. Well, there you go. So,
and hopefully it gets on where they can identify the benefits of that by basically being able to continue to participate in things they want to participate, especially extracurriculars, because we know that the kids are involved in extracurricular activities, doing things. This will lessen that chance of having to sit out and miss some of that time because of quarantine or because of illness itself. So that is another benefit.
Well, and it's a great conversation to really have maybe more in depth the benefits to a 14-year-old from getting the vaccine, because I think we're all aware the risk of severe disease needing to be hospitalized, for example, in that population is much, much lower than, say, that of a 65-year-old, and we're well aware of that. But there are many benefits.
Yeah.
One you just described, right? Not needing to be quarantined from school or from sports or other extracurriculars if you were to either be exposed or have symptoms. There's also less risk for traveling, and maybe even the need in some cases to have a vaccine before traveling. There also is, of course, that benefit of protecting those that you care about who may be at high risk, even if they've been vaccinated, and especially if they can't be vaccinated for some reason as it relates to, say, the timing of cancer treatment, which, again, isn't a contraindication, but we may make a very defined medical decision to, say, wait till after a specific round of chemotherapy or something else to have the vaccine started. So there are a lot of benefits, not just the individual benefit of, well, I'm less likely to get sick.
And individually, although it is rare, that multi-system inflammatory disease, getting the vaccination is likely going to reduce the chance that your child has to get that. And we've seen that here at the hospital. We've seen, healthy athletes, high school age athletes, who get this multi-system inflammatory disease and are just laid out and not doing well for weeks at a time. So this will even help reduce that very small risk of happening.
Okay, Anne is from Sedalia. She's also a registered nurse. She says parents of our school-aged children are picking up COVID-19 in the community. Our school-aged children aren't getting COVID at school because the mask-wearing policy. She says parents are bringing it home to their children. The community question is there any way that children can test out of quarantine? She says, as a nurse, I tell them no, but she wants to know what you think.
Yeah, I mean, per the guidance, you are able to test out of quarantine as early as 5 days after exposure. Now, we also know that in the household, household contacts and attack rates, certainly, number one, I think they are increased with the B117 variant, which is the more predominant or prevalent variant right now in our area and in our region. There is less attack of the kids when are in the household when the kids are spreading it to the adults. But there is that higher chance of having, when adults have it, being able to spread it to the kids. So there is that chance if the adults are bringing it home to the kids. So getting the vaccination is important. And that's one other reason why we have to continue to wearing masks in the community, in those schools, to keep the people safe as well.
Yeah, I think a very, very great example of the impact and benefit of mask wearing. It is very true, right? When we are seeing children or teenagers who are positive, it's not because of transmission in the classroom where masks were being worn. It's transmission in other places, whether that be extracurricular or outside of the school setting. And so it is a great observation. I think it is very true. The question about testing out of quarantine, of course, the CDC does offer that guideline as early as 5 days. but there's still some stipulations. Even after that time, you have to
Yeah.
monitor for symptoms twice a day, and if you have any symptoms, you should be retested again, because it is possible that at 5 days we won't catch even with a PCR test, we won't catch every infection.
Yeah, and I think we would recommend not doing it as early as 5 days, but more that 7-day. And certainly if you can get a PCR test, that's probably going to be more sensitive to pick it up.
All right. Jean wants to know, are we seeing more reactions from 16-year-olds to the first shot than in older adults?
Not in our
Not
experience.
that I'm aware of, no.
Yeah, I'd say in our experience we're seeing less, even in the way of not reactions, but just general symptoms as it pertains to
Yeah.
fevers or achiness or chills after the vaccine. So I don't think any evidence out there that's been published, and not in our experience either.
And from what I saw today in the reports, that group from 12 to 15 really looks to have the same or less of those side effects than that 16 to 25 age group as well.
All right, one more question?
Sure.
Okay, so Pat wants to know, my 12-year-old granddaughter will be in her brother's wedding this Saturday. Should she run out and get vaccinated before that? So you might want to go over the timeline of, again.
Well, I think first,
Yeah.
just because there was an expansion of the emergency use authorization yesterday doesn't mean that a 12-year-old can be vaccinated today. There is still at least the step of the advisory committee, the CDC advisory committee approval. I don't actually know, I have not heard with any certainty if that meeting is scheduled this week or next. I've heard any day.
Yeah.
But today, you can't get a vaccine if you're 12.
Yeah.
Soon.
Yeah,
Yes.
they have seemed to expedite those meetings, just as you said. I would expect maybe tomorrow or Thursday even is a possibility, but who knows? But yes, then they have to make their recommendations. I think I heard as early as Thursday, but will it be available? Will other places have the system set up? You know, certainly I would think like Children's Mercy or something would, but there are still a couple more steps to get to. But
Yeah, so I think we're expecting that the first day, the absolute earliest, might be Friday this week, but probably next week. And so the question of, well, if Friday is available, should my 12-year-old get a vaccine Friday before the wedding on Saturday? Well, you probably won't have really any meaningful immunity from the single dose one day before. And it's very possible that there might be some mild sort of symptoms of fatigue or fever afterwards, and so probably not a rush out and get it Friday in that circumstance, at least as it pertains to getting benefit on Friday. Of course, the earlier the better for everyone, so don't delay, but Saturday probably won't be a big difference if you have a vaccine on Friday.
And I know I said final, but this is the final, and it comes from Anil, who's one of our long
Anil.
haulers,
Yeah.
and it is for our guest today. The question is, are we setting up any group sessions, perhaps virtually, for families or long haulers or survivors? And he talks about how, in his wife's case, she has been really affected and is really concerned for the future.
Great question.
Yeah, at the Battle Within, we currently don't have caregiver or family services, just due to the size of our organization and our commitment to serving the overwhelming number of warriors themselves. That said, there are resources out in the community, caregivers on the home front, for example, for veteran and first responder communities, and so they do exist out there, and I do recommend reaching out to them. It is a family unit, and we tend to heal better when we heal as a family.
And Anil, I don't actually know if we have kicked off the long hauler support group from a patient perspective. We'll get you that answer. We know how to get in touch with you, but I'm actually unaware if we have any plans for, actively in the works for an immediate sort of group option for caregivers or family members affected. But it's a great question, and I think
Great idea.
We'll connect with our team here to see what their thoughts are on that, and maybe if there hasn't been some action there, maybe this is exactly the sort of nudge we need. So very much appreciate that, and Jill and the team will be sure to get you answers, and we'll share them with the community as well. Well, tomorrow, our focus here on mental health continues with a closer look at what our pediatricians are seeing in their clinics and in their inpatient admissions. Dr. Steve Lauer, Dr. Mike Lewis, and Dr. Stephen Lassen report more and more appointments and admissions stem from mental health issues, causing physical symptoms in many cases, and cause for alarm. They'll offer signs to watch for that your child needs help and tips for keeping our youngest population safe. As we wrap up today, as we always do, any final thoughts? Adam, we might start with you.
Yeah, I just appreciate the opportunity to speak about this. I think that mental health is so important. It affects all of us, and if we don't suffer personally, I guarantee that all of us know someone who is. And be sure that whoever you are, wherever you are, to check in with the people that you care about and ask how they're doing, and then ask how they're really doing.
Great advice. Thanks. Justin, final thoughts?
Yeah, and I'd really echo Adam. It's all of our jobs to ensure that we're taking care of one another, and so it's going beyond the Midwestern "How are you? I'm doing fine," and really asking the question, "Are you okay?" and following up with them and checking in with one another. And if you need help, then that's okay to reach out for that help and seek those services.
All right, Doc Hawk.
Yeah, I think it is extremely important. We know that COVID-19, the pandemic year, has exacerbated or even led other people to develop new mental health issues. We need to continue to be on top of it. Let people have those resources to seek out that therapy, seek out those resources to really get better and stay healthy, because it's all combined: physical health, mental health, emotional health. Hopefully we are moving out of this pandemic. Hopefully some of those issues will get taken care of just by opening up. But what is the important things to opening up? It's continuing to do those things we've talked about, those non-pharmaceutical interventions when you can. Again, masking, distancing, meeting outdoors, doing things outdoors, and of course vaccination. And hopefully we are going to be able to get one more segment of our population vaccinated, and then therefore keep our community and population healthy as a whole.
Yeah, it's a great point. I think that the benefit here that we see from a community or population level, with beginning to get 12 and up now included in vaccination, will be huge. And nothing, well, almost nothing about the last year has been easy. For many people, the challenges have maybe compounded things that have been going on in their lives long before COVID was even something that we knew about. And I think all of the things we've talked about today, the ability and awareness of when to reach out, which is really, as we said, I think as our guest said so well, anytime you're concerned about yourself or someone you care about, ask them how they're doing and how they're really doing, and connect them in whatever way you can with any services they might need to keep them healthy and safe. And recognize that, just as we mentioned, vaccination and sort of ending COVID is good for everyone. There's a benefit, both physically, obviously, if you don't need to be ill or in the hospital, but also mentally and emotionally as it pertains to those thoughts around control and removing, I love the analogy of the glass, removing one stone from the glass to keep the water from overflowing. So great messages in there today. As always, if there are things that we can do to help in any of those perspectives or regards, please don't hesitate to reach out and let us know. As we wrap up today, nurses are some of the most resilient people I know. The Kansas Hospital Association is helping us to celebrate Nurses Week with a video they made to honor nurses. Look closely and you may recognize nurses from here at the health system, from Nemaha Valley Community Hospital in Seneca, and from William Newton Hospital in Winfield. We'll see you tomorrow. Schedule your vaccine and remember to wear your mask.
I call the shots, I drop it like it's hot. I'm a force to be reckoned with. I learned a lot what my mama taught. That's how I know